Hi, everyone. It's Alex Savidge from KTVU Fox 2 News in the San Francisco Bay Area, and we want to discuss some of the latest news surrounding the coronavirus outbreak. And to do that, we bring in Dr. Vanila Singh, who is a clinical professor at Stanford School of Medicine and also former chief medical officer with the Department of Health and Human Services. Dr. Singh, great to have you on.
Great to be here. Thank you, Alex.
All right, so the Biden administration coming into office and announcing a major effort to try to ramp up vaccine deliveries out to states. And the administration is saying that it's going to work to buy an additional 100 million doses of the vaccine from both Pfizer and from Moderna. Obviously, that goes a long way toward giving states whatever they might need here in the coming weeks and months to administer the vaccine. Where do these doses come from? How do you think the administration was able to secure them?
Yeah, so it's such an important move forward, I think, with the additional purchase. This was in addition to the 400 million doses that were already secured under the prior Trump administration. And this, of course, is in light of the challenges that we've seen across the country in terms of predictions of vaccine supply issues, and already the state of New York had to have further allocations because of their worries about not being able to deliver. This is something that is clear we're going to need. I think that Moderna and Pfizer earlier committed to what they could do in terms of their manufacturing ability. Since that time, certainly the government has also secured means to extract more vaccine doses. Perhaps that's helping it, but also they've had more time, and hopefully they'll be able to do it again, because this is just for this season. And if the COVID virus is still around, we're certainly going to have to incorporate this annually if needed. The other thing on the horizon that's really important is Johnson and Johnson's single dose vaccine. Hopefully that will come around soon too, to add to the supply from this increased demand that we're seeing all around the country, from people who are 65 and older, all the different workers and teachers and folks who may have medical conditions.
The administration obviously, trying to ramp up supply as much as possible, and also looking to set up these federally supported vaccination sites in conjunction with the states. How much do you think that is going to be helpful in terms of getting individual states to be able to actually deliver the shot, put the shots into people's arms on that local level, which has been a challenge up until now? There have been a lot of states, California among them, that have struggled really to get the doses they have into people's arms.
That's right. I mean, the biggest issue is when we have these unfilled slots that are happening, and this is a time issue as much as it is a vaccination issue. We want to get the vaccine in a timely manner because of the surge that we saw, the record number of deaths and hospitalizations. So it's really important that we get those shots into folks now and not have these missed opportunities. That certainly will be helped by the federal efforts from FEMA, having stations that people can go to perhaps in certain areas where there are greater challenges. I think also with CVS and Walgreens and these other pharmacies moving to help vaccinate the general public right now, they've mostly been involved in the long-term nursing homes. So there has to be easy access for the public to go. And also there's been great confusion about who gets it when. This is done at the local county level. Some places are doing 65 and older, others are doing 75 and older. So that leads to a lot of confusion. And I think it needs to be much more clear per state, per county, how people can get it done.
Yeah, with that being said, I mean, in California, we have 58 counties. Forgive me if I left anybody out, I think. But I mean, but obviously you have a bunch of different counties and theoretically a bunch of different rules and guidelines for who's going to get the vaccine and when. Would it make more sense for us to just have state level guidance that is followed all across a state, a huge state like California that is, it sounds like at this point, at least the state wants to do it based on age and not necessarily based so much on someone's occupation. But do you think it should be sort of a top down from the state level, guidance comes down and everybody follows suit as opposed to a patchwork of guidelines for who gets the vaccine?
I think that would be helpful and make things more clear. And ultimately, they can modify that based on, say, LA County versus Fresno versus other counties that have different logistics, different demographics. So maybe a generalization so that the state understands and people understand. And then, of course, the counties can announce in a much better public message, public service message. That, hey, certain folks can now get it. This has been the big issue in terms of who do they call, and even when they've called their doctors or the county, it's been very confusing depending on which county it is. So I think state guidance has a role to play, and then also we can then say, look, it can be modified based on if the challenges that a certain county has.
Yeah, that makes sense. Last question here on sort of the efforts to increase the amount of vaccine doses that are being given out in this country. Another sort of promise, if you will, pledge from the Biden administration, which they are saying is that they expect to have the supply of doses in this country to a point where they will have enough doses to be able to vaccinate 300 million Americans by the end of this summer. A lot of people are going to hear that, and that is certainly sounds encouraging. Gives you a lot of reason for optimism. Do you think that is realistic?
I think it is realistic to believe that we can not only secure those supplies, but learn from what we've seen in the last few weeks. These are the hiccups that I think are expected in a massive vaccination rollout that we're doing right now. So, do I believe it can happen? Absolutely. We have to keep that goal there if we actually want this conferred immunity to make a difference in terms of the virus and transmission, something that hopefully we're able to get under control so that we can resume business. And I don't think it's lofty at all. I think it's absolutely necessary. And we certainly have the capability. But now, in the last few weeks, we've learned that we need more stations, we need more information, we need better public service announcements for folks who are interested in getting it and just don't know how to do it, so that we don't have these unfilled slots that are clearly occurring.
Yeah, there's so much confusion around how do you sign up for a vaccine? How do you know if you're eligible? How do you know if doses are available? Yeah, we've got to work on streamlining the process, certainly. Let me ask you here about all the concern about some of the different variants of the coronavirus that are out there. We have the first variant that we know of, at least that first surfaced in the UK. There's another that's reported to be circulating in Brazil, another in South Africa, and also, as we talked about, a variant that clearly spread pretty quickly here in California as well. How concerning are these variants, given that from what we can tell, at least they spread more easily, and why is it that they are more contagious? What is it about them?
Yeah, so this is exactly the big concern, big talk everywhere, is these emerging variants that we're hearing about. Certainly the one in the UK, we know, because of the genetic drift, the change, the slight change in mutation, it allows for these viruses to get in, the COVID-19 virus to get in easier. It's easy to transmit. And that is something that, of course, is more worrying. Usually that easier, greater transmissibility is also, uh, fortunately, comes with a less deadly virus, although people speculate and are, of course, concerned, scientists are concerned that could the mutations lead to, of course, worse, deadlier viruses that are more contagious. That would be the worst certain scenario. In California, we heard about a variant that presented itself perhaps in June, was identified, but then reemerged in October in LA County, and may in fact be accounting for the increased surge of cases that we saw in LA County these last few weeks. And I think that's really important to keep track of. From what we know right now, the variants are still able to be combated by the vaccine, which is really important. But
Yeah.
it's going to be important to watch if that vaccine is less effective in the coming months.
Yeah, that certainly is the big question that obviously scientists and medical professionals want to figure out is the vaccine that we have currently going to protect people against these different variants that are out there. And to that end, it seems like the consensus so far is that the vaccine will be effective against the variants. But then you hear the news that Moderna is already working on some sort of a booster shot to try to offer additional protection, I guess, against some of these different strains here. So that then that kind of gets you thinking, well, there must be, there must be some concern that that the vaccine is not going to be entirely effective against the different strains.
Look, these scientists at Moderna are amazing. To be watching this is very much a part of what their expertise is in infectious disease, to watch a virus and to watch if there's genetic drift or a significant mutation is really important. The fact that they're keeping an eye on it is something that I would expect, and I applaud that they're doing it. But it's going to be very important to watch that. To have a booster shot would only enhance the immunity if in fact, even if the variant is a little different and the vaccine is generally effective, it'll be important to see that if this option is there, if we have any concerns of waning immune ability against these viruses, if our antibodies are not working as well as we would expect against the viruses, or if in fact their effect is not as long lasting as we
Right.
are thinking. That's another reason to have the booster shot. Remember, that was a big concern early on, is what we're not really clear on is how long the immunity lasts in any of us. So I would think it would already be very good for them to have a booster should we get into that scenario where in a few months we need a booster.
Yeah, but either way, the takeaway, from hearing about booster shots, the takeaway from that is that everyone should get the vaccine as soon as possible to before we see what these various strains of the virus spreading in a more rapid way. It sort of feels to me like sort of a race against time, right? I mean, we want to get as much of the population protected with the existing vaccine we have before you have these variants kind of take over.
Exactly. I mean, what we really want to do is slow down the transmissibility. So we know the vaccine protects folks from getting the virus. That's important because if you're less likely to get it, you're less likely to have it and spread it. So it affects transmission, it gets the virus under control. And yes, if in fact there are new variants, we're ahead of it. We can then handle that as well. And we do understand now the COVID-19 virus. And if there are variants, we do have a head start. We understand what we've been through. So I think that we're going to be much more capable of fighting it. The most important thing is that we're able to track the variants and track the effectiveness of our vaccine.
Yeah, and to that point, do we have an effective way to track cases of these different variants? I mean, do we have a good way to see where these different variants and different strains of the virus and where they're spreading, what the hotspots are? I mean, because it seems like we've had trouble from the start, really, just tracking the original COVID-19 virus.
Yeah, absolutely. So when the PCR samples are taken or any samples are taken, the public health agencies are likely looking at this. My guess is the reason that they know about the California variant and others is because they're keeping track, and they're likely looking at samples, particularly if there's outbreaks, unusual, unexpected, that they're going to check that sample from those folks to make sure that there's nothing unusual going on here, to get to understand what's the cause. Is it some gathering, or is there a new strain? And that's exactly what they did in LA County. They were aware of that and they tracked it, and now they see that perhaps some good percentage of the cases are due to that new variant. Same with the UK. So this is part of the tracking that is going to have to occur for our country really, and the world, to ensure that we are still able to fight the virus.
Yeah, well, all of these variants being more contagious, it just means we all have to double down once again on all of the existing safety measures that we have at our disposal. Keeping our distance, wearing masks. I guess some people are saying wearing two masks at the same time might not be a bad idea at this point. But we have to really like redouble our efforts when it comes to those safety measures.
Yeah, and one really important point is that the recommendation, and this came out in the New England Journal of Medicine, is that even after you get your vaccines, it's not till 12 days after the second shot that you actually have the conferred immunity that we're hoping for you to get. So until that point, it's really important to continue all the methods, everything that we know, the social distancing, the mask wearing, the hand hygiene, and not to take it for granted that you just have the immunity, and it's 95% effective. It's not 100%, but 95% is excellent. And so if folks can just remember that, that they really have to wait several weeks before their first shot, before they kind of start to feel a little more comfortable about their situation.
Yeah, yeah. Getting one shot or even two shots of the vaccine is not a license to go do whatever you want. We still have to take precautions, as hard as that is to hear, but that's the truth though. All right, we appreciate your time as always, Dr. Vanila Singh, clinical professor at Stanford School of Medicine and former chief medical officer with the Department of Health and Human Services. Thank you so much for your time and your insight. We'll talk again next week. Thank you.
Great. Thank you. Great to be on.